So I had a cringeworthy story I'd like to share about my recent visit to my dentist. Let me preface this by saying I love my dentist and dentist office, and I'm not going to say who it is because it doesn't really matter. But love the practice. My whole family loves the practice. My wife loves the practice. She's the one that found it. My son loves the dentist, which is kind of just saying you love your dentist is unusual. And I've had bad experiences with dentists all my life up until this practice. So all that said, I know that the practice is growing, and also I know that the dentistry industry suffers from a trust issue with patients, and there's a lot of money involved. And as with anything, when there's a lot of money involved, there's a lot of opportunity for things to happen that might be seen questionable from the consumer's end. And I've never gotten that feeling with this practice. That's why I love it. It's not like Reflections Dental. I don't know if they're still around, but when I went there years ago, I felt when I left that place that I needed to take a shower, because it was just like I thought it was just, instead of dealing with a medical professional, I was dealing with a used car salesman. And all that said, I have bad teeth. Not a lot of cavities, but just messed up teeth. And when I found this practice, I was ready to start going through orthodontia, adult orthodontia. Never had it as a adolescent. And it was a big move for me, and I figured it was time, even at the ripe old age of 49. And they helped me get onto that path, and it was a team effort. I had oral surgeons involved. I had obviously the orthodontist involved, and it was the Invisalign system that I picked and I used. And that took 4 years, and I share a video of that down in my feed. But took 4 years. Loved every minute of it. Was happy with every single step of the way with my dentist and their practice, basically acting as a project manager, so to speak. I think that's a very apt description. And one of the things, since if you're not familiar with the Invisalign process, is it's not like the traditional braces where apparatus is epoxy to your teeth. You don't have wires or whatever. It's just these removable liners that come out that you pop in and pop out. Ideally, you take them out less frequently than you have in your mouth. So that these little plastic liners, which are 3D printed, and they basically slowly move your teeth into position. But the huge benefit of it is being able to take that out and be able to have like normal conversations with people without the stigma of having adult braces. And but again, my teeth were screwed up. And one of the things I've always asked, and because as an adult, one of the most common issues as an adult, as far as in regards to your teeth, is grinding, because of the stress, the physical, the emotional stress we are under. Grinding is probably one of the most common issues that adults have. And if you follow my channel, you know I love every facet of health. And more importantly, I love to learn things about my own health and how I do things, so I can change things if they need to be changed. And so one of the things I really want to know is like, hey, am I grinding? Am my molars being worn down from the stresses I put on my life, being a husband, father, single business owner, small business owner, elite athlete, all these things. Surely all of that pressure has to have caused my teeth to grind. No sign of it whatsoever. And again, I've been through countless either dentists in the practice or just dental professionals with this whole Invisalign process. 2 really good orthodontists in the practice that would see me on a routine basis. I guess what were the checkups, every month or so, every 6 weeks or so? it was 6 weeks, every 6 weeks. And that went on for 4 years. And they would always want to see my last set of liners to see how things are going, obviously, how things fit on top of the new ones, but also just to inspect it. It's like, hey, are there issues here? Never had an issue with grinding. Ever. And to that, one of the other, aside from having janky teeth, I have receding gums on 4 corners of my mouth. And under the advisement of the dentist, they wanted me to get all the orthodontia stuff done, kind of get the foundation right before they start messing with the gum issue, only because they found it's possible, because your teeth are so crooked, that that's actually kind of pulling your gum away from your teeth, and sometimes when you align your teeth, the gum issue kind of doesn't, the damage is there, but it kind of sorts itself out as much as it possibly can without having to put in basically fillings on top of the gaps that of the gum that's receded. So once this process was done, I slowly started to have those fillings put in, and I just had one, I guess, in September. And so it's on my dental chart, and I've been told about this from day one. And this is the beauty of having a chart, because a physician's chart is because that document, that file, should contain all the information of your visits and just any other notes, like such and such has 5 children and is whatever kind of professional. In my case, an air conditioning repairman, and just all kinds of just not useless, useful information. And the more information, I believe, the better. So going forward, I knew I had to slowly fill in my the gaps in the gum, because that was like the final step of the holistic picture of fixing my teeth. That said, going from my routine 4 months, my quarterly, triannually. Every 4 months I go for cleaning, which is way more than I ever used to go to before I started seeing this practice. But that's how comfortable I was going to the practice, and how much I liked them. I don't want to tell you how many years I went before seeing a dentist. So I went to my the 4-month cleanup, mostly cleanup. And the hygienist immediately mentions, do you have a night guard, a mouth guard? Did you bring it? And why didn't you bring it? And did you know that we can give you free cleaning? It's like, okay. The hygienist over over the course of her cleaning my teeth mentioned this twice, almost verbatim. Bring your night guard, we can clean it. And as an air conditioning repairman, I know this. I don't do residential work, but I know this, that when residential companies tell you, oh, we can come and give you an HVAC system inspection for $29.95, or I think it's down to like $30 now. It's only that cheap because they want to get their foot in the door to find out that you need a new furnace or all kinds of other problems. It just makes sense, right? There's no way with labor rates now in DC well over $200 that they're giving away over an hour trip. You got to drive there, get set up, meet the customer, and then leave for $30. It is a loss leader to get your foot in the door. And the same thing is to inspect your mouth guard to see if, I'm assuming this is what it is, to see if there's, they can sell you a new mouth guard, but also to see if there's any teeth grinding. And I get it, totally get it, it's fine. And they're there to help, right? That's why I'm there. And I didn't bring mine because I knew I didn't have any teeth grinding issues, and I honestly forgot, and it wasn't that big of a deal. And I just saw my orthodontist in December for a 6-month checkup. And now they said everything was fine and they don't need to see me for another year, which kind of tells you how well my teeth are doing up until this point. Anyway, the hygienist starts in after that, immediately, like, your gums are receding. Your gums are receding. If you don't get this taken care of, you're going to need a root canal. And while she's cleaning my teeth, she's standing right here, and I'm looking over my shoulder, or to my peripheral vision, and I can see the monitor with my chart on it. And I was kind of hoping that they would look at my chart first before they start reading me the riot act about something I've known about for the past 6-7 years, because that's how 6 years. That's how long I've been going to that practice. That rubbed me the wrong way, but I was just like, okay, fine, whatever. But I'm an adult, and adults don't like to be lectured, especially if you're paying for it. And I was being lectured, and I didn't appreciate it, but that's fine. And going back to the chart. The last time I was there, 4 months prior, I had one of their new dentists there. And this is what impressed me. And this is why the chart is important. The hygienist cleaned my teeth. She did a great job that time 4 months ago. And I could hear, I was like, okay, I'm done. She said, I'm done. I'm going to ask for Dr. So-and-so to come take a look at you. I said, okay, I'm totally used to this. I'm waiting, looking out the window. And then I can just hear someone come up from behind me. It's like, hey, Mr. Wong, hi, I'm Dr. So-and-so. I hear you've been on American Ninja Warrior. And I'm like, what? And it's like, yeah, it's on your chart. And I'm like, oh, yeah, man. And he's a young dentist. He's youthful looking on top of it, but I have to imagine he's no more than 27. No more than 27. And I was touched, because it's like, wow, that was a nice little note that someone left on my chart, and it helps create a rapport between the customer and the doctor. I am ultimately a customer. Keep that in mind. I was touched, and I said, yeah, and I was telling him, he's like, tell me more about it. So I was telling him the story. He's like, yes, in fact, doctor, your generation is who is the biggest group of, the demographic of the show. And he goes, yeah, I know, I grew up with it. So you could tell he was a huge fan. And frankly, he's just kind of amazed that he was sitting, helping a real life American Ninja Warrior. That was just an amazing experience, because it's like, that is the power of the chart, not only just from the technical aspect, but in creating an atmosphere and a rapport and a comfort level with your patient/customer. So again, she's reading me the riot act about stuff I already hear, to the point where it's belittling, it's patronizing, and most importantly, above all else, completely unnecessary, because I know all of these things, right? Okay, she's done. Then someone I hear, in this case, I hear someone come behind me, and it's a woman's voice, and it's like, hi, I'm Dr. So-and-so. And she comes around and says, do you have a bite guard, mouth guard? Did you bring it? By the way, we can give you a free cleaning of the guard. Okay. I could have sworn right behind me there was a giant sign saying, remember to ask patient if they brought their mouth/bite guard, to remember to bring it. Next time we can give you a free cleaning. And I'm like, okay. And then she's like, okay, can you open up your mouth? And she looks like, oh my God, you've got your gums are receding, and you need to get that looked at or taken care of. Okay. It says it right there. If you took 10 seconds, like the previous doctor 4 months ago did, to just look at my chart, just to read the summary of what my condition was, I wouldn't have to hear this. I was like, oh yeah, okay, no. And then she was like, wow. Are you aware you clench your teeth? And I said, what are you talking about? And she says, this is one of the worst cases of teeth clenching I've seen. And I'm like, wait, what? And she says, yeah, I haven't seen, I have only seen, I said to her, actually, what I said to her is like, no one's ever mentioned to that in me. And at this point, I'm getting annoyed. I am annoyed. I was like, no one has ever mentioned to me. And I've asked whether or not I grind my teeth. And I said to her, so I'm clenching my teeth, but I'm not and I'm grinding? And she goes, no, you're clenching your teeth. So bad that it's one of the worst cases she's ever seen. And then she describes, like, if you weren't clenching your teeth, and I said, not grinding, just clenching, I said to her, because I've never heard of anyone clenching their teeth, but never grinding, which, given my muscle control, it could be possible, but it's highly unlikely. And she goes, yeah, no, with the wear on your teeth, that would not be possible. That's the only thing to explain. That's the only way to explain how they are shaped now. Basically, my molars or canines have, no, molars have it's a V. But also keep in mind, for the past 4 years, in every sleeping moment and for most of the day, I've had plastic liners, basically giving my teeth a protective shield. And prior to that, no one's ever said, oh my God, your teeth are worn. And so I'm like, that doesn't jive with what every single person has told me and every single person in this practice has told me. And she goes, yeah. And she gets behind me and then she asked me, in this tone of voice, if I can reproduce it, what do you do for a living anyway? It is this indignant tone. And I was kind of not defensive at this point, but I kind of maybe thought it was a poorly delivered question, like the previous doctor had given me. Hey, by the way, I heard you on American Ninja Warrior. Or it was a coy way of asking me about that. No, it wasn't. She wasn't being coy. She said to me, I have only seen this level of clenching on people that suffer from PTSD. I repeat, I have only seen this level of clenching on someone with PTSD. And she said, if you were a service person, first responder, I could understand. And I, like, again, this is all shock to me because she's telling me I have the worst case of teeth clenching she's seen, yet no one in 6 years has told me that, despite seeing multiple professionals about my teeth. And now she is giving me or telling me indirectly that I have issues on the level of someone with post-traumatic stress disorder. That was about the point I was about to tear off the bib and just walk out of there. But I stayed because I'm a calm person. But more importantly, I was absolutely shocked. Like, I cannot believe she went there. And I said to her, yeah, okay, whatever. I'll look into it. And I said, I'll get this taken care of, the gaps, so I don't have to get a root canal. And both the hygienist and the dentist both mentioned to me, you're going to need a root canal if you don't get that taken care of. Okay, nice scare tactic. Thank you. Given that every other dentist here said it was important, but not saying resorting to the scare tactic, like, you got to get this taken care of, like, right now. And again, I'm kind of wondering if there's a sign behind me telling me push root canals or push customers, scare customers into submission by telling them they'll need a root canal. Anyway, I get up leaving. I'm kind of like just shocked at just what I experienced. Never, ever, ever had that ever happened to me. And, I go to check out and they give me the fluoride treatment, which they didn't ask to give me. And that was $55. And on top of my insurance and the copay, whatever, that for the appointment. And then I leave and I'm like, that just doesn't sit right with me. What just happened? That's just wrong. I need to complain to someone. And so I come home. And I decide I had to look up on their website to find a contact form. And it's just, basically a name, email, phone number, and your comment. And I'm like, yeah, that's a little too impersonal. And I've got basically a long story to tell because this has taken me, I don't know how long this has taken me, 20 minutes to tell this part of the story. But anyway, I decided, what, I'm going to call. So the next morning I call and I say, hey, can I speak to someone to complain about something, to complain about my visit yesterday. And I get the office manager, and she knows who I am. I can't remember who she is. I'm sure if I see her, I'll know who she is. But she was a great listener, and she basically listened to the story I just told, and she was incredulous. She could not believe it. In fact, to the point where she had a couple zingers as far as, some mean things I could have said in telling the story. But she deeply apologized and said, obviously, we're not going to let you see that other dentist or that hygienist again, and that they'll tell the owner of the practice. But it was just, I just wanted to capture the story because I don't want to I don't want to live in a world where a medical professional can't feel comfortable to tell a customer hard truths, because that's the stuff. I don't want to be in a world where that is, that's the line that people don't want to cross. But here's the rub. That's not my case at all. I've had countless medical professionals in the dental industry look at my teeth and look at my liners and look at how I've been, and not a single one told me the problem that she said was so dire that it was on the level of someone who was suffering from post-traumatic stress disorder. So that is it. The thing here is, the comment was completely inappropriate, but to go back further, what was really bad is her lack of knowledge. I questioned her competency, and then on top of that, her lack of professionalism to even just not even look at a chart that is there for a reason. So if she just knocked out those first two, was competent and actually looked at my chart, and then throw in maybe had a better bedside manner, I would take the PTSD, take the PTSD diagnosis, because maybe I'm rubbing my teeth, clenching my teeth, not grinding, clenching my teeth so bad that they're being worn, and I need to address and acknowledge that. But that's not the case, because no one's told me that, and no one, and even the office manager looked on the chart and said, "Yeah, Mr. Wong, I don't see any sign of anyone saying you grind or clench your teeth." And I'm like, yeah, because it's not happening. And your dentist is a quack, and she probably should be fired, but that's not my decision. So, short story long, thanks for watching. Advocate for yourself. Be kind. Be competent. If you're in a profession that has records and you're going to address a customer who is a long-term customer, look at the records, because you're going to dig yourself a hole otherwise. Because if you what's the saying? If stop digging when the dirt is over your head. Both the hygienist and the dentist already had the dirt over their head when they started reading me the Riot Act about the gum issue. Like, that's just unnecessary. As opposed to saying, hey, I noticed on your chart last September you got this filled. Do you think we should do it coming now into the spring? And as opposed to reading me the Riot Act, like, hey, you're going to need a root canal if you don't get that taken care of. Anyway, thanks for watching.